Hi, I'm Myra. Today, I wanted to talk to you about hyperlipidemia and provide some education on this chronic condition. What is hyperlipidemia? In order to understand what hyperlipidemia is, we first need to understand the role cholesterol plays in hyperlipidemia. So, what is cholesterol? Cholesterol is a waxy substance found in your blood. Your body needs cholesterol to build healthy cells, but high levels of cholesterol can increase your risk of heart disease. With high cholesterol, you can develop fatty deposits in your blood vessels. Eventually, these deposits grow, making it difficult for enough blood to flow through your arteries. Sometimes those deposits can break suddenly and form a clot that causes a heart attack or stroke. High cholesterol can be inherited, but it's often the result of unhealthy lifestyle choices, which make it preventable and treatable. A healthy diet, regular exercise, and sometimes medication can help reduce high cholesterol. When it comes to symptoms of high cholesterol, it's important to note that high cholesterol has no symptoms. A blood test is the only way to detect if you have it. Cholesterol is carried through your blood, attached to proteins. This combination of proteins and cholesterol is called lipoprotein. There are different types of cholesterol based on what the lipoprotein carries. They are low-density lipoprotein, or LDL. LDL, which is the bad cholesterol, transports cholesterol particles throughout your body. LDL cholesterol builds up in the walls of your arteries, making them hard and narrow. High-density lipoprotein, or HDL. HDL, which is known as the good cholesterol, picks up excess cholesterol and takes it back to your liver. A lipid profile also typically measures triglycerides, a type of fat in the blood. Having a high triglyceride level also can increase your risk of heart disease. Now let's focus on the factors you can control, such as inactivity, obesity, and an unhealthy diet that contribute to harmful cholesterol and triglyceride levels. Factors beyond your control might play a role too. For example, your genetic makeup might make it more difficult for your body to remove LDL cholesterol from your blood or break it down in the liver. Next, let's review medical conditions that can cause unhealthy cholesterol levels, which include chronic kidney disease, diabetes, HIV/AIDS, hypothyroidism, lupus pressure. Cholesterol levels can also be worsened by some types of medications you may be taking for other health problems, such as acne, cancer, high blood pressure, HIV/AIDS, irregular heart rhythms, organ transplants. Factors that can increase your risk of unhealthy cholesterol levels include poor diet. Eating too much saturated fat or trans fats can result in unhealthy cholesterol levels. Saturated fats are found in fatty cuts of meat and full-fat dairy products. Trans fats are often found in packaged snacks or desserts. Obesity. Having a body mass index, BMI, of 30 or greater puts you at risk of high cholesterol. Lack of exercise. Exercise helps boost your body's HDL, the good cholesterol. Smoking. Cigarette smoking may lower your level of HDL, the good cholesterol. Alcohol. Drinking too much alcohol can increase your total cholesterol level. And age. Even young children can have unhealthy cholesterol, but it's much more common in people over 40. As you age, your liver becomes less able to remove LDL cholesterol. High cholesterol can cause a dangerous accumulation of cholesterol and other deposits on the walls of your arteries, atherosclerosis. These deposits, plaques, can reduce blood flow through your arteries, which can cause complications, such as chest pain. If the arteries that supply your heart with blood, coronary arteries, are affected, you might have chest pain, angina, and other symptoms of coronary artery disease. Heart attack. If plaques tear or rupture, a blood clot can form at the plaque rupture site, blocking the flow of blood or breaking free and plugging an artery downstream. If blood flow to part of your heart stops, you'll have a heart attack. And stroke. Similar to a heart attack, a stroke occurs when a blood clot blocks blood flow to part of your brain. When it comes to prevention and preventative measures, the same heart-healthy lifestyle changes that can lower your cholesterol can help prevent you from having high cholesterol in the first place. To help prevent high cholesterol, you can eat a low-salt diet that emphasizes fruits, vegetables, and whole grains. Limit the amount of animal fats and use good fats in moderation, Lose extra pounds and maintain a healthy weight. Quit smoking. Exercise on most days of the week for at least 30 minutes. Drink alcohol in moderation, if at all, and manage stress. It's important to know when to see a doctor. According to the National Heart, Lung, and Blood Institute, a person's first cholesterol screening should occur between the ages of 9 and 11, and then be repeated every 5 years after that. It is recommended that cholesterol screenings occur every 1 to 2 years for men ages 45 to 65, and for women ages 55 to 65. People over 65 should receive cholesterol tests annually. If your test results aren't within desirable ranges, your doctor might recommend more frequent measurements. Your doctor might also suggest more frequent tests if you have a family history of high cholesterol, heart disease, or other risk factors, such as diabetes or high blood pressure.